curious about hair transplant in thin golden hair with fair skin. How successful is hair transplant in such kind of patients who have very thin golden hair and their skin is also very fair, especially in American patients? In this video, we are going to discuss the planning and results of one of our patients from America who underwent a hair transplant with us last year in August 2023. But before we discuss his plan and show his results, I would like to tell you how you can preview the results of your hair transplant by using Saraswat Hospital app. We will discuss about that also. This patient of ours was 41 years old and was suffering from hair loss for many years and had not taken much of medical treatment. He was having a slowly progressing hair loss. At the time he presented to us, he had receding hairline, some thinning in the tufty region, as well as his crown was also quite thin. So he was suffering from grade 3 male pattern baldness with thinning in the vertex or the crown also along with that. So this was his hair loss scenario. And then we did his trichoscopy, which is a software based analysis of his donor site. So we found out that his average density at the donor site was 82 follicular units per centimeter square. His average thickness of hairs at the donor site was 0.065 millimeter. Majority of his hairs were terminal, which is a good sign of a good donor site. Average number of hairs per graft were 2.1, which is again on the higher side. Then we calculated his donor area and we found out that he had around 12,000 to 12,500 follicular units available in his donor site, and his coverage value at the donor site was 11.19, which is again on the higher side. Please like the video if you are finding this information useful. Then we planned his hair transplant and we found out that the area in the front and mid scalp was 63 square centimeter, and we planned to have a density of 45% of the normal density, which was around 37. And at the crown, since he had some hairs there, we planned a density of 30 follicular units per centimeter square, and the area in the crown was 36 centimeter squares. We will show you the number of grafts which we did in his case, the 1 hair, 2 hair, 3 hair and 4 hair grafts. If you are also planning your hair transplant, or any of your family member or friend is planning a transplant and they want to get a consultation with us and they want to plan a hair transplant in a scientific way, then you can call us at the numbers given below, or you can WhatsApp us on these numbers along with the pictures, and we will try to revert back to you at the earliest. Also, you can put your comments in the comment section if you are planning a hair transplant. In his procedure, one very important thing was that he himself wanted a mature hairline, which is very good, and this shows the signs of maturity in our patients. We also agreed with his hairline and we marked this area, did the trimming, did all the routine steps which are like giving the local anesthesia, making the slits, keeping in mind the normal angle and direction. Then we extracted the required number of grafts. Then after the graft sorting, our team did the insertion of the grafts into the slits or the sites already created. This entire procedure took around 7 hours or so, along with the pre-procedure preparation time. After the procedure, he was quite comfortable. He followed all the instructions which we had given to him very diligently. We were in touch with him and he was routinely sending his pictures at a sort of some quarterly interval. We found out that the progress was good. The things were going as per our plan. So you can see his results. We have the pictures here on the screen to show you the before and after pictures in a patient who has golden hair, thin hairs, and the skin is also fair. You can see that the hairline has come out nicely. The crown has also improved substantially, and overall the improvement is very good. He is very specific about the medicines. He does not miss the medicines out. These medicines keep the rest of the hairs also in place, and it prevents in the progression of the hair loss in such kind of cases. We request you to subscribe to our channel to watch more and more of such kind of videos. Now let me discuss with you our Saraswat Hospital app, which has an artificial intelligence algorithm which can show you or give you a peek of your possible results after your hair transplant, and along with that it tells you about the number of grafts required in your case and a few questions you should be asking your hair transplant doctor. And there is specific customized input from both me and Dr. Preeti Saraswat, and this app is available on both the platforms, iOS and Play Store. The links for those apps are given in the description below, from where you can download it and use it for your own convenience, absolutely free. Now, just a few take-home messages from this video. Please plan your hair transplant with the doctors who are qualified, experienced, preferably members of ISHRS and diplomats of American Board of Hair Restoration Surgery. Choose a clinic which is showing with the number of grafts transparently on the machines where they are extracting the graft on that machine. Every patient needs to be having a customized planning which suits his facial profile and his hair loss pattern and the grade of hair loss. Choose a clinic which is using trichoscopy as an advanced tool to find out what kind of results and what kind of donor site you have. Clinic which has a good follow-up team. The good follow-up team is also absolutely essential, where they are routinely in touch with you so that you are not feeling alone and out of the place. There is a lot of hand holding. So these are the points which I want to share with you regarding this patient. You can see this video on the left to have a peek about our app, and if you want to see the latest results of one of our patients, you can click the video on the right.